COX are bloody painful and I need to tell you why. See, in our body exists two cyclooxygenase enzymes called COX-1 and COX-2. COX-1 is nice, he's friendly, we love COX-1 because he is always on. COX-1 is responsible for secretion of gastric mucus and bicarbonate, which protects the gastric lining from acid. COX-1 maintains renal blood flow, especially when you're in a low volume state like dehydration and bleeding, protects you from kidney injury when you don't drink anything but coffee and tea. And third, COX-1 is responsible for the production of thromboxane A2, which helps platelets become sticky. So when you have an ouchie, you don't just bleed to death. Meanwhile, COX-2 is an arrogant fludger. We don't like him that much, but he's still important. COX-2 is inducible. He only comes to work when he wants to. These are cardioprotective, but also make platelets less sticky, so you don't just clot everywhere for no reason. Now what non-steroidal anti-inflammatory drugs like ibuprofen do is be a huge cock blocker. Just like her friend at the club. Oh my god, she's got a boyfriend, don't you dare. By blocking the two COX-2 in particular, it stops your pain. It helps reduce swelling. But if you take too much ibuprofen for too long, block that COX-1 and 2 for too long, you can cause gastric ulcers because there's no more mucus and bicarbonate. You cause bleeding, especially if the patient is on warfarin or some other anticoagulant because platelet aggregation is even reduced. And finally, you cause kidney injury, especially if the patient is already on diuretics and blood pressure medication. Trust me, the pharmacist will hate you. And because you've blocked COX-2 for too long, oh my god, there goes your stroke and heart attack risk. Up to the moon.